Healthcare costs can add up quickly, especially when you have a condition that truly never goes away. For those diagnosed with rare or autoimmune diseases, the wounds caused by financial burdens cut much deeper than the disease itself. On this episode of Health Digest, we unpack the rising cost of care for these patients. Autoimmune diseases are on the rise globally, and for many countries, the growing number of patients makes this poorly understood category of disease a public health crisis. Maureen Muturi, a 27-year-old from Nairobi's Karen neighborhood, is just one among the many who live with this debilitating condition that occurs when the body's natural defense system is unable to distinguish between one's own cells and foreign ones, prompting it to mistakenly attack normal cells. For illustrative purposes, think of it as soldiers in a battlefield turning against each other after mistaking one another for combatant enemies. The results can only be disastrous. And for Maureen, the raging war within her body has been taking a toll on her since 2012 when she was diagnosed with fibromyalgia, a condition that causes pain all over the body, sleep problems, fatigue, and emotional and mental distress.
Before the symptoms of fibro showed up, my right knee used to dislocate to the side. So it dislocates to the side on its own and comes back. That was extremely excruciating. And in 2010, I was done a surgery that went well and I healed well. But in 2012, when it recurred, I went back to surgery, but that did not go as planned. So 2 weeks after that surgery, I started having pain, electric-like pain. I want you to imagine when you switch on a light with your wet hands, that feeling you get, that kind of pain. That would spread later from my toes to my ankle, my knee, my hip. I was on the right leg, because the right leg was the one that was affected. But then much later it spread to the left, and much later the hands and my head.
Pain is the hallmark symptom of this condition, and researchers believe it is because it amplifies painful sensations by affecting how one's brain interprets signals.
When the pain reached my head, that was it. Life has never been the same again. And we went through 10 Kenyan doctors between January and July of 2012, trying to find the source of pain. However, I was 16 when it happened. So there were doctors of the opinion that I am running away from school. So that's why I'm pretending to have pain. Others would call my mom aside and tell her that I'm having some emotional pain that I am converting to physical pain, as if that's possible. And by reaching the 10th doctor, the pain had increased. I kept on being admitted for pain control. That's when we decided to go to India, because by then everything in my body was messed up. My hormones were off the charts. I would have very painful cramps during my menses. They would come twice a month. I was not sleeping. I had insomnia, chronic insomnia. So a lot of things had gone wrong. So all of them listened to me. Second day, did tests that they wanted to rule out anything that they were thinking about. Then the third day, the doctor sat me down and gave me a physical test and pressed certain points in my body. And when he did, I was short of screaming because it was so painful. But no one else had done that physical test. So immediately he sat me down and told me, Maureen, you have a condition called fibromyalgia. It cannot kill you, number one. Number two, I know that you've been told that you're not in pain or you're faking it, but I want to tell you that is real pain. He put me on medication, and the next night I slept, and I hadn't slept well in 6 months.
Her chronic condition requires her to receive pain medications that cost at least 500,000 shillings annually. Similarly, Muturi's annual cost for laboratory tests are upwards of 250,000 shillings annually.
It depends on what is happening in that month. Because if I am in a lot of pain, it means I need pain medications. Pain medications, and they're actually the ones which are more expensive. So think about, if I've gone to a doctor and they want to rule out something, they'll do tests and then from there give me medication. That's like 40K a month. Then the next month you have to be admitted. That's inpatient. You've spent 600,000-700,000 based on how long you have stayed in the hospital. It's expensive.
Even with health insurance, her out-of-pocket expenditure remains high. She typically has at least 4 admissions per year and a series of monthly outpatient clinic visits during the same period. For her, the cost of healthcare has increased steadily since she was diagnosed with the disease. But it wouldn't have been like this had insurance companies changed their policies on how they cover the condition. Currently, the package autoimmune patients get from medical insurers is too little to see them through the treatment journey annually.
Our medications are very expensive. You can't even get them over the counter. They're very expensive. So instead of having our inpatient and outpatient drop, you can be given, for example, if you're given $1 million for outpatient, trust you me, by May, it's over. Do you know how many times my cover ran out when we were in May and in June? And then from June to December, you cover from your pocket. And I can't do anything about it. So instead of putting clauses to shut us out, how about clauses that give us the opportunity to be able to take care of our health, the medications we need? Oh, and the blood tests that we have to do. When you put blood tests and medication, that's what finishes our cover. So if there's a clause, if there's even anyone, even if we start from NHIF being covered, it would really help.
One of the greatest hurdles faced by patients with autoimmune disease is continuity of care due to financial constraints, and Farah Khalek, a resident of Nairobi, knows this too well. Farah also lives with an autoimmune disease known as scleroderma, which is characterized by hardening and tightening of the skin and may also cause problems in the digestive tract, internal organs, and even blood vessels. Although she is currently on supplements, she is required to undergo a stem cell transplant whose cost she cannot meet.
Currently, I am on supplements only, so you can say I'm maybe just about below 20K a month. But I do have a treatment that I need to go for every 2 years, or maximum 2 years, but within a year. And that stem cell treatment, I need to go for that, which costs more than 1 million shillings, you know. So that's my major concern. That's my major treatment for me. So, and if you see patients, some patients have steroids that they're taking. I avoid steroids. I don't like steroids. I avoid them completely because they give me the flare up of my skin, which you see right now. So I avoid steroids at all costs. And so some patients, if you see them, they have steroids, they have supplements, they have all sorts of medicines, injections that they take on a monthly basis, and some of them cost well above 100K a month. So it's really limited, and we are, as a foundation now, trying to find out how we can address this by conducting a survey. We are going to be launching the survey this week, and we really want to find out what is it that the insurance companies are not addressing. I want to find out how much have they covered, and how much needs to be covered as well, because it's enormous, and so we hope with this information, we'd love to engage with insurance companies and have a sit down with them and tell them, look, let's find a way where we both can work together and try and address this gap, because they're people, they're just like you and, and we deserve a better life in terms of policy development, coverage, medical coverage, insurance coverage. It's too limited. Autoimmune and chronic disease warriors have to visit their doctors, their practitioners, on a monthly, or is it, I think, even on a fortnightly basis, because just the other day after our forum, the next day I was unable to move. So a flare can happen just anytime, and you're literally unable to move from bed. And if you can, I feel like on that day, if I just brushed my teeth, that's a big thing for me. That's a really big thing, So I'll just be here on the sofa on my bed, covered nicely under 2 blankets. I'll have a hot water bottle and just sit it. I can't move. It's too cold. My body starts hurting. So there's a lot of constant checkups with the doctor. You have to have labs for the test. All our tests get sent to South Africa, India, or is it Germany? They don't have those facilities here to do those tests, to determine. And then come back to now the costing of this condition. It's enormous, it's over the roof. And if you most of us, we are not employed, because employers always see us as differently able, that we can't work, And so there we go, the burden is all on the family. And the toll now that takes, not only on the patient, but on the family overall. So it's a lot that needs to be addressed.
It is a misnomer, really, because the treatment or management of other non-communicable diseases like cancer and kidney disease is given special consideration by most insurers, including the National Health Insurance Fund. Whereas one would argue that cost is a huge barrier to treatment for patients diagnosed with autoimmune and rare diseases, this yoke is often doubled as they have to deal with the disease itself while at the same time shouldering the immense financial burden that comes with it.
The other plea is also to request the same NHIF insurance if they can allow the patients to also are able to purchase comprehensive insurance, because one of the advantages the NHIF insurance package has had for the patients who are on it is that they don't discriminate and call them pre-existing condition and limit their cover. But once you have the NHIF comprehensive cover, NHIF has been very kind. It actually allows the patients to get full treatment for as long as their cover is available without labeling them as pre-existing or such.
Health insurance companies have sub-limits for chronic ailments. They argue that a patient with chronic illness does not receive treatment to recover, but rather to manage the condition. And that is why a number would limit inpatient cover to between 400,000 and 500,000 shillings for such conditions. This, they add, is also meant to encourage patients not to remain in hospital and end up incurring huge bills. Just like in any other business, they argue that companies must be able to calculate risk and see what they can accommodate.
We recognize that without access to treatment by funds, then it's very challenging for patients. And I'm grateful to the government because the provision of public care, let's say in the context of rheumatology, the rheumatology unit in Kenyatta National Hospital in Moi Teaching and Referral Hospital, then has widened the scope of care, because this care then is available and is the public system is actually available at low cost.
Rheumatologists, who are doctors who specialize on autoimmune diseases, recommend the need for early diagnosis and treatment. They say that patients who are diagnosed early with autoimmune diseases and get appropriate treatment are less likely to experience life-altering conditions and may require less expensive therapies, which are often effective in the early window. But more often than not, patients like Halek and Muturi are misdiagnosed and treated for other conditions before doctors eventually nail a diagnosis.
If we can, straighten out the diagnosis, we can really make a change for all years, especially those who suffered for years, not knowing what they are going through. Because, Gloria, your body is at war with itself. Your autoimmune system is attacking itself, So now, where do you turn to?
It took me 6 months to be diagnosed. Trust you me, I am the most blessed in that group, because most of them took 10, 12. There's another lady who took her 20 years to be diagnosed with fibromyalgia. So all these years, you're misdiagnosed. You're told you have arthritis, or maybe you have lupus, or maybe it's a maybe, but you're not making it to be exact. So if you don't know what it is, how do you treat it? It's important that the doctors, let me shock you. The most people that we have received kind of resistance from, and how we've been treated badly, medical practitioners. And it is so shocking, because that's where we come for help, but there are doctors who, first of all, you're too complicated a case, so I can't deal with you, so you're just told, okay, you're faking it. Then there's that one who outright doesn't care. I mean, the things that doctors have told us, we can't even repeat them. Someone is in pain and you're told, no, it's just that you're just fat. To your face. So if they would just listen, slow down and listen. Rheumatologists who deal with autoimmune and joints and muscles are like 8 in this country. No, 7. Before we had 4. So I'm glad that there are others. But we know them in Nairobi. So what about someone in Eldoret, Mombasa, Kisumu? How about those? But if they would just listen, that these symptoms that we have, we are not faking being sick. We are faking being well. We fake being well, and we do it so beautifully, you wouldn't know.
In a bid to manage the high cost of treatment that comes with these conditions, doctors advise patients with chronic conditions to at least have 2 inpatient medical covers from different insurers in order not to be grossly exposed. Additionally, they recommend coordinated care where patients do not have to see specialists from different facilities in order to minimize gaps in care.
We don't need one specialist. Our symptoms are so varied, so diversified, patient to patient. You will see someone who has scleroderma who doesn't look like me, but they have scleroderma. Some of them, they don't even have the same pigmentation, but I do. And so you'll see that for me, I will have to see a dermatologist separately. I have to see a rheumatologist separately. I have to see someone for the digestive system separately, because of the symptoms of my conditions.
You hear from a doctor in, doctor out. I started asking myself, am I crazy? Are they actually right? And I would sit down, listen to this pain, and just think, I cannot be crazy. This pain is there. It's present. And the worst part about it is that you cannot find fibromyalgia in an MRI test or a CT scan or blood tests. No, that was working against us. So because they couldn't see it on tests, they just assumed you are faking it, you know. So I was feeling lost. I was feeling depressed. I was very depressed because I have pain constantly, and now it has evolved. I'm having migraines. I'm having problems with my stomach. I'm having problems with my periods. There was nothing that was untouched. So I kept thinking, something must be wrong. I knew, I had a gut feeling that something is wrong, even though they said there wasn't. But there's just feeling inside me that told me, no, something is wrong.
Severe lack of awareness among the medical community and the public, lack of data to inform policies, lack of coordinated care, and limited allocation to fund research and development are said to be among the factors starving this group of disease the attention it requires. Educating patients about the condition they have been diagnosed with also plays a big role in their treatment journey. And experts say patients who are well conversant with what is ailing them are likely to become more compliant to medication.
Even after getting the diagnosis, there was not much that could happen, you know, because it's a rare condition. Doctors just give you steroids and they tell you you have to manage it for life. Something I wish I had been told, you know, by my doctor in the DNA, that I wish they would have just explained to me that what was going to come now for me. They didn't tell me that I was going to change, you know, that my physical appearance will change. I will develop reduced mobility. And yeah, I really wish I was prepared for it, but I wasn't. My initial 7 years of, you know, understanding scleroderma was really dark. I didn't know what it was. I didn't know why I was changing. I thought I'm turning into a monster, you know. Am I the only one in this world? There was a lot of frustration, a lot of devastation, confusion, just hopelessness, you know, and it was really dark. My family was with me. My family support is, I don't know what I'd do without them. Really, I really don't know, especially my mom. She's been my support, my caregiver since, you know, my mobility started to reduce. So yeah, so she takes care of me, she dresses me, she washes me. She makes me look like the most amazing person that you see today. She dolls me up, and yeah, she's always there for me.
To those who've undergone countless pain, fatigue, and they've constantly known that there's something that's wrong, get to a rheumatologist. They're the ones who can diagnose it, then you can start being on medication. However, we are differently abled. We are not disabled, we are differently abled. So despite the fact that fibro ravages almost every part of your life, you can still be great and extraordinary. I am a coach, I am an author, I'm an inspirational speaker. I have people who are realtors in the group. There are some who are KRA lawyers. We are still as brilliant as we would have been without fibro. Yes, we struggle, but we can still be something. So it's just like a beacon of hope that if you see me here and having really dragged my feet to be seated here, I know that you can still be something. Loved ones who don't understand us, just listen. Sit, listen, ask questions, and believe that when we say that we are in a scale of 1 to 10, we have 6, just know that that's 10 because we always under, you know. So we appreciate your love and your support, and we just ask for patience.
Rare diseases are not rare anymore. As they increasingly become a public health crisis, experts call for a multi-sectoral approach to address issues around cost in order to facilitate continuity of care. Gloria Milimu, KTN News.